Hi, good morning. This is Dr. Carol Reiser. I wanted to take a few minutes to show you a few things about the diagnostic kit. It will look something like this. Hopefully you have picked this up already or had it mailed to you. If you were not at orientation, you may not have come to campus, but you can look on Blackboard and see that there's a way that we have provided for you to have the kit mailed to you at your expense. So hopefully you have received this by now. If not, hopefully you'll receive it soon. But let's take a couple of minutes, look through it, and get you familiar with some of the equipment that you will receive. One of them is a tuning fork. Simple piece of equipment you probably have not used before. You may have, but more than likely if you're just in clinical practice in a hospital, you have not used this. So a couple of things about the tuning fork. There's a video on Blackboard that you can take a look at. It shows students using all of this equipment, so you can view that and become familiar also with using the equipment. I'm just going to go into a few little caveats. The tuning fork, to use it, you strike it on the side of your hand, preferably here. Some people I've seen hitting the back of their hand. That's a little more painful. But here on the fatty part of your palm, strike it like that. You'll feel the vibration. You place it on top of the person's head or behind the mastoid, depending on what you're testing, and you will be able to hear, they will be able to hear the vibration. You can also feel the vibration. If you touch the tuning fork here in the body of it, you will alter the vibrations. So you don't want to do that. You want to hold it only by the handle, strike it on your palm, place it on their head or behind the mastoid, on the mastoid, until the vibrations stop. Okay? Very simple. So that's the tuning fork. Inside your kit, you'll find the ophthalmoscope and the otoscope. These are probably something that you're not so familiar with, but don't be worried. We're going to go into them in detail. First, let's look at the ophthalmoscope. This is the handle. This is where the light source is. This is the head. It just pops in like this. You can see that there's a little depression on this head piece that should go right into this little notch here. So you place it in there, give it a good twist, and it's secure. To turn it on, the little green button on the side slides. Depress it and slide it. It only goes one way, so that you will have the light source, and you can see that there's the light there. Now I'm going to turn the light off for our purposes here. This is a little thumb roller tool here on the side. When you look through it, your finger should be up here on the side of the ophthalmoscope so that you can change the focus of what you're seeing. So you'll have this eye closed, your other eye looking through here. You will thumb the little thumb wheel here until you have a focus. You'll get close to the patient's face, close to the eye, I would say about here, with the patient's eye and your face. So you're very close to the patient. And we'll talk more about that sort of technique when you come to intensives. But for now, this is just how this piece of equipment works. So you'll also notice that on the front side of the ophthalmoscope is another little wheel. That is what changes the light. If you shine it on your hand, let's turn it on here. If you shine it on your hand and then rotate that little wheel, you'll see that the diameter of the light changes. There's also a blue light you can select, a slit light, and a light with a grid. Most of the time you will want to select probably the medium aperture, just round aperture of light. That works best for most things. One more thing about the light. As you're practicing on your friends and family and your dog or whatever, whoever's cooperative, you'll want to keep in mind that the intensity of this light is fairly fairly brisk. So if you're practicing, you're going to spend a lot of time up against your patient, your family member, and you're going to shine that light in their eye. If you will tone the light down a little bit, and you can do that by sliding this little green, depress it and slide it forward just like you're going to turn it on or off, and it will alter the intensity. So if you'll decrease that intensity just a little bit, your husband, your children, your pets will thank you, and they'll last a lot longer with your practice sessions, okay? So that's the ophthalmoscope. The same with the otoscope. It attaches in the very same way. Just put it on there in the depression, give it a twist. It turns on the same way. Depress the little green button and slide it forward. You get a light. Now, you'll want to have, you should have gotten a few of these covers. And we'll take one of those out. And it just attaches, let me turn the light back off. It just attaches by one little twist like that, okay? Like that. And it's disposable, so you'll want to, dispose of it after each use. Unless you don't have very many and you're practicing on the same person, then that's okay. That is the ophthalmoscope. Then the same goes, it has also an intensity setting here on the side. So if you can alter that and see which you like best. But it has a default placement for that intensity and where the little green line is. Okay? Head comes off the same way, just one twist. This is probably the most important thing that students don't realize when they come to intensives. They've practiced and practiced and practiced, and when they come to intensives, they don't have any battery left, and they don't know how to change the battery. It's a rechargeable scope. So you twist the middle of it like this. Oops, sorry, that's not right. That's where the rechargeable battery actually is. Okay. Well, I'll say this one's rechargeable. This one is not rechargeable. Let me see. Okay, figured it out. This part twists two ways. If I can fix it again. The first way, when I twisted it, it has a little rubber separator there. If you twist it one way, the lower piece, you see the battery. That's not what you want. Put that back on. Grasp the little rubber separator and twist the top piece off. That's what you want. That plugs into the wall. So that very simply will recharge your battery. So just twist it apart, plug it into the wall, let it charge, and be sure before you come to intensives that you have done that. You come with a fully charged handle so that you'll be all prepared. The other things that you will need, we will supply, like tongue blades, gloves, and such as that. Stethoscope, you'll need to bring your own to intensives. What some nurses don't know, also I've discovered, is that there's a lot of different kinds of stethoscopes, as we know. Now, if you have the kind of stethoscope that you can twist, you have a bell and a diaphragm. And if you can twist it to listen to the diaphragm, twist it again to listen to the bell, that's fine. Just remember to do that when you're changing like that. A lot of stethoscopes, like this one, are made so that you only listen to bell and diaphragm type tones depending on how hard you depress. So if you press hard, you have a diaphragm. If you press lightly, you have a bell. Okay? Now, the difference in whether or not you want to listen with a diaphragm or a bell is what? Think about that just a minute. most of the time when you are listening to vascular sounds, you'll listen with which one? The bell. Always listen to vascular sounds with the bell. So when you're listening to heart sounds, when you're listening to pulses, when you're listening to the abdominal vessels, those are all vascular sounds. So you'll want to let us know that that's what you're doing. If you have a stethoscope like this one, you'll say, I'm now listening to the vascular sounds with the bell. I'm pressing lightly. Okay? Easy enough. All right. Let's see. I believe that is about all the equipment to go over. I just wanted to give you this quick preview. So hopefully you'll have a little more technique when you practice, and you'll be able to discover some cool things about your family, your pet, your husband, your friends, whoever holds still for you to do the assessment on them. But practice, practice, practice. And when you come to midterm, don't be nervous. It's a great learning experience for everybody. You just learn so much, and everybody's nervous when they get here, but everybody feels really so much better about everything when they leave. You will need to have practiced your head to toe. Don't come to midterm intensives unless you have practiced your head to toe assessment. So we do expect you to have pretty much the steps down. So look at your rubric. Go to Blackboard and find it, and it's the one with all the different components. It's several pages. It'll be obvious to you on Blackboard, okay? But if you can't find it, or you're not sure which one it is, just give us a shout out on a discussion board, and we'll certainly be glad to point you in the right direction. But be practicing with that rubric so that you will start memorizing basically the steps to all of those assessment technique, all those assessment pieces, and utilize these techniques that we've talked a little bit about just on your equipment today. Okay? And if you have any questions, be sure and give us a call, an email, or best bet is discussion board, and we can certainly return your question in about hopefully within 24 hours. Okay? Hope you guys have a great day. Welcome to Health Assessment.